welcome to the Morning Crossfire. Our friends from the Public and Private Development Center, PPDC, are with us in the building. And it's time for Budeshi, where we make sense of data and open everything up. No shadows, nothing hidden. Let's all see what's going on. Well, today we're joined by the Chief Operating Officer of the PPDC, Nkem Ilo. Good morning, Nkem.
Good morning.
Welcome back.
Thank you.
Also, we have the Finance Officer of the PPDC, Helen Abawulo. Good morning, Helen.
Good morning.
And welcome to the Morning Crossfire.
Thank you.
We are also joined by Salome Toh, the chairperson of the Professional Association of Public Health Nursing Officers of Nigeria, PAFNA. Good morning.
Good morning.
And welcome to Budeshi. All right.
Thank you very much.
We've been talking, of course, about public health centers in 6 states, which was the focus of the PPDC's reportage of what was done with monies released back in 2014. You can follow us by using the hashtag #HowDoWeFixThePHCs. Yes, the hashtag is #HowDoWeFixThePHCs. Today we'll be focusing on equipping and staffing of the primary health care centers. And I start off with you, Nkem. Why is this important?
Don't treat people. The buildings don't treat people. The staff that make up the buildings that treat people. The nurses, the health workers, the people that work in those buildings, down to the security personnel, are the ones that treat the people. And that's why it's now important to go into these issues. Because even if we have a beautiful structure, we have the structure, we have the beds, we have the tables, we have the faucets, the equipment, but we don't have the people qualified to use those equipment. But as well sign death warrant for a lot of people. That's why it's important.
Because I think it was the fellow who had gone to Kano that said, was it the person at Kano?
That
said that a security man was having to treat.
Yes,
and some people were admitted in the toilet.
And yes, people were admitted in the toilet because no staff had been posted to the PhD that had been built.
Exactly. And that's one of the reasons why we're here this morning to talk about how do we staff. So we've talked about the buildings, we've talked about the fact that we have multiple primary health cares in some places, well, there are none in others. We've talked about the fact that some of them are dilapidated. Now let's talk about, okay, for those that are standing, for those that are supposedly working, are the qualified personnel that are needed to run those places there? What are the issues that those personnel face? How can we rectify it? How can we incentivize them to even come to those areas? Now, you look at the minimum standards released by the National Primary Healthcare Development Agencies, and you find for different categories of health centers, the health center, the health post, the primary health clinic, the primary health care centers, you find different categories of personnel. But then again, the question is, are these personnel qualified? They say minimum standards. Of course, you have to go beyond the minimum standards. Are these people qualified in them?
Let's bring Mrs. Toh into this discussion now. She's, like we said, the chair of the Professional Association of Primary Health Care Nursing Officers of Nigeria. That's a long name. But how important are you and your constituents to primary health care centers?
Thank you very much. I'm happy to be here. As been introduced, I'm the National Chairman of Professional Association of Public Health Nursing Officers of Nigeria, PAPNO. Now, these are a group of specialized nurses in preventive healthcare services, which is the same thing like primary healthcare you are talking about. We are supposed to be the forerunners and at the helm of affairs in primary healthcare in Nigeria, as far as nursing profession is concerned. We have nurses called public health nurses who are trained with special skills to manage primary healthcare services.
Okay. What are some of those skills that you're talking about?
Okay.
Especially as it has to do with specific needs of
Yes,
primary healthcare centers.
Yes, the training of public health nurses, as I told you before you have become a public health nurse, you must have acquired your basic nursing training. You must be a midwife if you are a lady. Then if you are a male nurse that want to specialize in public health nursing, after your basic nursing, you must attend an additional post-basic nursing, either in ophthalmic, psychiatry. So public health nursing is done as a a specialized form of nursing, whereby the concept is on trying to work with the community, identify community needs, and profiling solutions to the community problems alongside with the community. A public health nurse is trained to mobilize the community, to be able to create awareness to the community members on disease prevention. They support the community members at the level of a family unit, and their basic way of operation is home visiting.
Okay.
Before now, public health nurses were all over this country visiting families from a particular home to the other until the community health program came on board, and many of them were now, drawn back to the tertiary institutions. So that is what I'm talking about.
Right now, talking about equipping and staffing of primary healthcare centers.
Yes.
What really is the practice? Are you posted there by local government authorities, state government, or the federal government? What's the process of getting these nurses into the primary healthcare centers?
You know that basically in this country we have 3 levels of healthcare delivery in Nigeria. We have the primary level, the secondary level, and the tertiary level. Now, but the public health nurses in the primary health care must be absorbed by the local government services.
Okay.
And what we are clamoring for now is that if the federal government of this country want to revitalize primary health care in the concept of equipping and staffing, we still have 1,000 and more, or let me say thousands of this group of nurses that are out there. A lot of them are in private practice because they could not find job in the primary health care. It's just for the government to put up advert. We all know that right now the body that is driving primary health care in Nigeria is National Primary Health Care Development Agency.
Who is controlled at the federal level?
Yes, which is a parastatal under the Federal Ministry of Health. It is their prerequisite to place an advert and call for all public health nurses all over the country that are in needing employment. You understand?
But when it comes to the public healthcare centers, what are some of the issues that you have when it comes to the staffing of it? We've seen places, we've heard reports from the PPDC and even others that sometimes you have public healthcare centers where there are no staff, no nurses. Some, they're supposed to go there, but they never show up, or they can only make the trip once a week or even once fortnightly. What are some of the issues your members face that are already attached to PHCs?
Now, like I want to say before, one of the basic things that have contributed to the issue of public health nurses being found in these places, and even the other cadres of health workers, the community health workers and the rest, is the issue of lack of incentives. Take it or leave it. You and me, we will not want our children to be at the standard we are. We have a family and we want bringing up children. We want to work where the children will have access to social amenities, good schools. Now, most of these rural areas we are talking about, there is no water, there is no light, there are no good schools there. Many of them, they are hard to reach, far to reach, and these places amenities have not been provided. That is why you find it that even those so-called health workers that are being posted there, they find it difficult to be there completely.
But one would want to ask that, isn't that part of the training? Because if you're being trained for community health, you should expect that, look, these challenges are going to come in the course of the work. Isn't that put into consideration?
Now, yes, I would say yes, we are trained like that, but you or me knows very well that most of these countries that we're taking a leaf from, they did not just get it at first hand. There is to some level. We are talking about primary health care, which has come to be in the past more than 30 years ago, and we're still talking about the same thing because of what? Misplaced priorities. Agreed, we are trained to be in those rural areas. But if the government is making frantic efforts to be able to upgrade these areas, let them be accessible, motorable, they provide light, they provide housing, adequate housing to the minimal level that will be comfortable. Recently, I went to one of the states in the north, and I went for an accreditation of a school in one of the school in the north. There was a very gigantic primary health care, well built in a very large land. And this primary health care was not adequately staffed. There are no staff there. The place is so big, and the influx of patients is so high. During that time that I went there with a team of other health workers, we witnessed, within a span of 1 hour, we witnessed about 3 deliveries. And these deliveries, it's only one old midwife
That was just taking it.
that has retired, and she's not even from that state. And there were others that were already waiting. There we found 2 children that were severely anemic. You understand? And there was one lab assistant that was struggling to open the vein. Now we try to find out from him, what do you intend to do? They told us they want to cross-match blood and transfuse.
In the PHC.
Yes, in this PHC.
And they're not equipped to do that.
They are not trained to do that.
Oh.
But because there is nobody.
To do that.
So
they just have to.
they go out of their
Association, PAFNON, is doing to engage with federal, state, and local authorities to change this
yes, thank
horrible
you.
situation.
Thank you very much. We all know that the goal of healthcare delivery is to provide quality healthcare to the populace of any given country, wherever they are. Now, having identified that so many things are wrong, what we know that healthcare delivery is about teamwork. Now, we are making a lot of efforts. Advocacies have been conducted, and they are still ongoing to be able to create awareness and help to request the government and the policymakers to do what is expected of them, because for us to attain the healthcare delivery that we are expected to achieve in this country, using primary healthcare as the bedrock of a healthcare delivery in Nigeria, the whole world is looking towards universal health coverage. Now, there must be adequate mixture of healthcare workers at every given state of healthcare delivery.
Okay. Let me bring you in back again, Kim. To your mind, what really would be a sustainable way of making sure that all this is harmonized and that these PHCs are not just built, but staffed and equipped?
I think at this point, the conversations that we'll be having for so long now, I think at this point, we need to have the national primary health care on the table. I know, yes, they said their role is just to build and provide training and capacity building, just technical stuff. Then staffing is left to the local governments and the state. But I think at this point, the associations involved, and these are the professional associations, need to come together as one unified body and approach the different levels of state governments, the different levels of government. This is from local government to the state to the federal, and address these issues. Because it's one thing to build and to hand over. Yeah. It's another thing for the local government to staff, and it's another thing for the staff to also complain that our needs are not being met. But if all of us sit at the table and we determine that these are the minimum standards, this is the way forward, this is the best way to get nurses, qualified public health nurses, into those areas. When they sit at that table and a statement is issued and policies are made, that's the only way we can move forward.
You know, on the overall, it's not even just so much about the nurses, but it's about, you know, the failure of governance on the overall, because you don't have accessible roads, you don't have pipeable water, you don't have things that will make people want to come and stay in the place. Then how do you even expect them to, you know, come and carry out their
Exactly.
functions?
That's just it. Wow.
Good morning, all. Primary healthcare is more of health education, awareness, dissemination, and disease prevention. It's not supposed to be a territorial, regimented practice. Rivalry at all levels is killing healthcare delivery in Nigeria. Government has kept mute for too long, while healthcare suffers. There are reasons why many Nigerians abhor PHCs. The most crucial is staffing. PHCs perform better where they are physician-led. In Nigeria, employees craft their own job descriptions and dispositions. Ofi, can you allow your sister or wife to go to a PHC to deliver where there's no doctor? Says Henry. Why is everybody asking me to become a PHC worker or, you know, okay.
But that's also
But yeah,
important.
it's, just painting the picture.
I don't understand the rivalry. What's the rivalry between the different? I don't know what led to the rivalry. I don't know what caused the.
It's resource control.
This
Just
artificial.
like, I mean, when we had the honorable, yes, here with us the other day, he talked about it. He said very clearly, I mean, if I have to build a constituency project, I'll build it, not regarding that somebody has built one 4 years before.
Doesn't matter.
So it's the same thing. Federal agencies have to justify appropriated monies. Local governments have to justify appropriated money. So everybody's just trying to justify what they're supposed to do, regardless of whether it's harmonizing or not. So now already we have an issue with staffing of PHCs and want to build 10,000 more. Who's going to staff those? And yet we say that
We just want to have
unemployment
empty
is
buildings all around so that you feel all right.
30 seconds each on your recommendations. Okay.
Number one recommendation. I have off my head. You have the professional health association that the store is representing. You have the the National Association of Nigerian Nurses and Midwives. You have the midwifery, National Midwifery Council.
Yes.
Sit down together, sit with the National Primary Healthcare and the different states and come up with a solution. Let Nigerians
Let all
not
the
suffer.
players.
Yes.
Let all the players on board speak with the agency. Helen.
I think one of the recommendations I would like to recommend is there should be a clear definition of roles. There should be a kind of policy where boundaries are set between the nurses, the shoes, and the their shoes in the primary health care.
All right. Well, thank you very much, ladies. Thank you so much for coming on Budeshi. Thank you for listening to Budeshi.
Thank you.
We'll see you next week, Friday.
Yes.
We'll be back on the morning.